Ebola virus, formerly known as Ebola hemorrhagic fever, by Lexicon. Ebola. Ebola is a virus that causes severe bleeding, organ failure, and can lead to death. This is what it looks like on a microscopic level. History of Ebola. In 1976, Ebola first emerged. The first outbreak of Ebola infected over 284 people. And then a few months later, it was found in Yambuku and Zaire, which is almost the same place as Sudan and Zaire in the first place. It was founded by ITM researchers Guido van der Groen and Peter Pyatt. Since then, the virus has emerged periodically, infected people in several African countries. There's been outbreaks of Ebola in Russia, Africa, United States, and more areas. Years of Ebola virus disease outbreaks. There was 40 years of Ebola virus disease around the world. These are the years that there has been recorded cases, some of them being in the Philippines, some of them being in Russia, some of them being in the United States, most of them in the African area. The biology of Ebola. The Ebola virus belongs to the Filoviridae family. How does Ebola work? When Ebola enters the body, it targets several types of immune systems. Like any other virus, Ebola, one of their purposes is to inhibit the interferon. The interferon is a type of molecule that cells use to hinder further viral reproduction. When that's hindered, this Ebola virus can attack. People become infected through contact with infected animals or contact with bodily fluids of infected humans. Most cases are caused by human-to-human transmission. Infection can happen with the broken skin, or bodily fluids are touching other things, and when you touch that area, then it can be transmitted. The average Ebola virus disease case fatality rate is around 50%. Case fatality rates have varied from 25% to 90% in the past outbreaks. Community engagement is key to successfully controlling these outbreaks. Symptoms. Symptoms of the Ebola virus may include anything from a fever to severe headache, chills, weaknesses, stuff that a typical flu would have. Over time, symptoms become increasingly severe and may include diarrhea, red eyes, raised rashes, bruising, bleeding without an injury. So transmission from animals to humans can be by blood or waste products. Butchering or eating infected animals can spread the viruses. Scientists who have operated on infected animals as part of their research have also contracted the virus. Tourists in certain African caves and some underground mine workers have been infected with the virus, possibly through contact with feces or urine of infected animals in the area. Who is most at risk? The risk factors are when you travel to Africa, you're at increased risk. If you visit or work in areas where Ebola virus outbreaks have occurred. Conducting animal research. People who work with animals or dead animals are likely to contract the Ebola virus if they are working with them. Health workers, nurses, doctors, anyone working in the healthcare system can be easily infected by it through human-to-human contact. Family members, same way, in contact with loved ones or people that they knew who were infected. Medical personnel also can be infected if they don't use protective gear, such as surgical masks and gloves. The bodies of people who have died of Ebola are still contagious. Helping prepare these bodies for burial can increase your risk of developing the disease. Ebola causes hemorrhagic fevers, which can lead to death for a high percentage of people who are affected. As the illness progresses, it can cause organ failure, severe bleeding, jaundice, seizures, coma, shock. How is it controlled? There's a vaccine, the Ebola vaccine. It prevents disease caused by Ebola for people who are 18 years or older. This vaccine is given to help protect you from getting Ebola virus diseases caused by one type of Ebola virus. This vaccine will not protect you from diseases caused by other types of Ebola viruses. There are ways to prevent Ebola by staying clean, avoiding infected people, and not handling remains of dead animals or people.